theoretically, he should be able to do it.
Timing wise, I've heard some people say 18 months is the earliest, and I've heard other people say get them done before the growth plates are done.
So the earliest that we do them is 6 months of age, the absolute earliest, and we try and do those only in emergency situations. The growth plate that we worry about, so anytime from 10 months to 12 months, kind of 10 months really, is the growth plate that I worry about is the trochanteric growth plate, the one at the top of the femur. There's a growth plate there. His isn't closed at the moment. We wait for that one to close. The reason we kind of would prefer to wait for that to close is when we're reducing the hip, we put a lot of pressure on it, and it's where all the butt muscles, the gluteal muscles attach.
Which he doesn't have.
Yeah. But what happens is if we can fracture it off, and can we put it back on? Absolutely. But if it adds more implants, and and there's a risk that doesn't heal properly and things like that. Just recently I actually cut off a trochanter to put a hip replacement in a dog because I couldn't get the hip replacement in otherwise. Its trochanter was sitting way over the top over here, and I needed to put the stem here. So can we fix that? So we try and wait till that growth plate is closed, which is typically around 10 months of age. So anytime after 10 months of age. From a long-term infection control, unfortunately, I will recommend that he gets castrated.
Oh yeah, no.
Yeah, I usually wait until they are around 18 months of age.
Yeah.
Because he's a large breed dog. We want his growth plates to close down properly. And maybe that's a better thing that we should be waiting. The reason being is, prostatitis and bacterial infections within the prostate. Anything systemically that becomes a systemic infection can potentially cause latent infections later on. So castrating them, if he does have a lot of ear issues or dental disease, we try and treat it earlier rather than wait for it to get to a horrible status, which I'm pretty sure you're not going to do.
Yeah.
So we just treat things like that a little bit quicker. And so castration, and most of the dogs that we do that are young will do them at a later date, not necessarily at the time of the hip replacement. If we do both of his hips, sometimes I'll do it at the second, at the 8-week recheck of the second side, because it'll be about the right time. And we have to sedate him to take x-rays, and I just nip off, anesthetize him and nip off those things that bother everybody. Yeah. So theoretically, and reality of it is he should be able to go back to normal. Complication rate with a hip replacement, in my hands, is less than 10%. And the minor complications, even a fissure or a fracture of the femur, I still call it a minor complication because I can deal with it, and we can still keep the implants in place.
So 6 weeks sort of rehab on this?
The first 2 weeks is just bathroom and back. They'll use it pretty well the day after surgery, and some of them will turn the knee out a tiny bit, just because of muscle and things like that. But most of them I expect them to weight bear on it the day after surgery. Some of them look good and never look back. It depends on the dog a little bit and how tight the hip is. The first 2 weeks, leash, bathroom and back. We give you a harness to help him up.
I've got one. I just bought one.
Perfect, yeah. Just to help. So you're assisting him. You're not carrying him. You just need to assist him, minimizing stairs and things like that. What I don't want him to do is slip and fall, because in the first 2 weeks, we're relying on the implants to hold the hip in place until the joint capsule heals that I just created whole.
Gotcha.
So if he slips and falls, he can luxate the hip.
And he's very much, as you're saying, if they've been caught at 16 to 20 weeks, but I mean, he doesn't do it anymore, but he lay like this with behind all the time,
which is fine,
and he splits out that way.
I don't want him to do that. We give you Prozac for puppies to kind of help keep him calm during the period. Some people I usually give for 2 weeks. Some people
give the parents the Prozac too.
Yeah, kind of. It's trazodone, which is an ADHD medication, but it does calm them. From 2 weeks to 4 weeks, we start just very short walks on leash. Very, very short ones. We want to be very careful because we don't know when it integrates. Probably the bone grows in or integrates.
It's going to be winter too, and ice and all that.
And the bone integrates into the implant between 6 and, we think, somewhere around 6 weeks. So until then, until the bone's integrated, we're relying on the press fit. So the more they're moving, the more likely it's going to move. And we every day we expect them to get better and better. If something changes, we need to know about it. We recheck them, because before the bone integrates into the implant, sometimes I've had them move a tiny bit and not had to do anything more for them. But if there's a major change in the implant position, we have to go back, and it's easier to do it before it integrates into the bone, because getting it out once is quite hard. This one was integrated. You can see the bone hasn't even come off the.
Gotcha.